Hello, today I'm going to talk to you about my experiences here with the French healthcare system. Thank you so much for joining me today. If you're new here, welcome. My name is Patricia Brooks. I'm an American living in the south of France and have been for close to 8 years now. And now I have a career where I help people who are ready to start the next chapters of their lives living and thriving in a foreign country. And I help them in a couple of ways. I help them by helping them to create the kind of mindset that will allow them to have success in their new country. But I also help them in the planning phase and helping them to create a project plan that will allow them to feel more clear about what is required and help them to reduce the uncertainty that they feel in making such a big life change. On this channel, I talk about my life here in France, about making a move abroad and how to build the confidence and courage so that you can live the kind of life that you know you are meant to. And today I'm going to be talking about the French healthcare system from my personal perspective. Now, this is going to be a ride-along video. A couple weeks ago, I went to visit a friend who lives in a neighboring town called Amélie-les-Bains, and I filmed the trip there. So you're going to get to enjoy that scenery and that trip. I want to start off by saying the French healthcare system is wonderful. The fact that I can have health insurance at a reasonable price without having to be a citizen is phenomenal. As a resident, I am eligible for what is called the carte vitale, which is the French health insurance card. In addition to that, I have what's called mutuelle. That's a supplemental health insurance that covers what the carte vitale doesn't cover. Now, I pay into the Social Security system here in France, which includes that carte vitale. So it's not free health insurance like I've heard some people call it on YouTube. I do pay into that. Every 3 months, I declare what I've earned in my business, and a portion of that goes to my social charges, the carte vitale, my retirement, my disability, all of that's training. A little portion goes to training so that I can keep my skills up. Anyway, I feel pleased that I have this. And it is a great system because if I were to get sick, if I needed to be hospitalized, at the end of that, I would not have to file for bankruptcy. And that has been the case for people in the United States because health care is so expensive and health insurance doesn't cover everything that you can find yourself in a really dire situation like that. So I am very fortunate to have health insurance, the health insurance I have here. That said, that does not mean that the French healthcare system is not without its faults. And I wanted to bring you this video because I talked to many people who are looking to move abroad. Many want to move to France. And sometimes their primary reason is for the healthcare. And I just wanted to give you my personal experience and the challenges I face in this system. Okay? So when I first got here to France, I didn't have a problem finding a primary care physician. I was very lucky because my landlord happened to be a doctor. And so he became my general care practitioner. Not a problem. His office was just below my apartment, so I didn't have to commute to get to a doctor's office. And when I first moved here, I did not know that I qualified for the carte vitale. So I paid for my medical expenses out of pocket, but that wasn't a problem because it was affordable. Getting my prescriptions, my 2 prescriptions filled for a 3-month supply, 12 euros, maybe. And going to see the doctor, if I had to pay, would have been about $29 US. But my landlord never charged me. He said, oh, no, you don't have to worry about that. Later, when I got the carte vitale, when my former boyfriend of mine said, oh, no, you absolutely qualify as a resident of France for the carte vitale, and he helped me get it. Later, when I got the carte vitale, I offered it to my former landlord at this point, and he's like, no, he waved it away. So that was amazing, right? I was really fortunate. But the problem was he was older. And a couple of years ago, he retired. And so that left me looking for a new primary care practitioner. I went to a site called Doctolib, which helps you find medical professionals. And I found one not too far from where I live in Serres. And it was about a 15-minute drive. And I made an appointment. And I made the appointment. And then I went and I sat in the waiting room for about an hour and a half past my appointment time before I actually saw the doctor. So that was something that was a little bit off-putting, but I saw the doctor. He seemed to be pretty proficient. He seemed to be a good doctor. He took my blood pressure. He didn't weigh me. I think that he did request a battery of blood tests so he could understand, what was going on in my body. And he filled my prescription. And that was what I wanted. And it seemed like, okay, he could be a good doctor for me. And so I requested that he become my primary care physician. So that got all taken care of in the system. He was now my new doctor. But over the course of a year, having to go to see him and wait long periods of time, that was a source of frustration for me. But I dealt with it. However, the reason he's no longer my primary care physician is because one time I was just about out of my medicine and I went to schedule an appointment on his calendar and I couldn't get an appointment for close to 4 months. And he didn't have a receptionist that I could call in and say, hey, I need this prescription refilled. So I felt a little bit stressed. And so I went to the pharmacy and they said, okay, we can give you another refill on the prescription you have, but this is the very last time. And I said, okay, thank you so much. And so I had to find another physician. So I did. The next one was in Collioure, a beach town about 35 minutes from where I live. And the first time I had an appointment with him coincided with a protest here in France. There was a strike, farmers were protesting, and this new doctor that I was seeing was coming from Spain into France to his office here in France. And so I got to Collioure in plenty of time, and there was a queue of people standing outside of the doctor's office. And I asked what was going on. They said, oh, well, he's running late because of the strikes. He's coming from Spain, and the border, the toll booths between Spain and France were being blockaded by the farmers. And so he was experiencing delays because of that. And so that was odd to me. And I asked, well, what time was your appointment? And they said, oh, it was, 45 minutes ago. So he was going to be really running behind. So I said, okay. So I decided I was going to walk around Collioure because it's a beautiful town and then come back and see if he had arrived. And so when I came back, there was not this line outside of his office, and I went in. I didn't have to wait too long, even though he was delayed, by this protest. And I thought, oh, well, that's pretty good. That's refreshing, I thought. Anyway, make a long story short, he saw me, but he didn't take my blood pressure. One of the medicines I take is blood pressure medicine. He didn't weigh me. He didn't, asked to do a battery of tests. And I was thinking, I said to him, I'd like for you to be my primary care physician, thinking, well, I found somebody who has appointments available and is accepting new patients. that I might as well go ahead and get signed up. He's like, well, because I'm running behind, we can do that next time. And so I thought, okay, the quick appointment and then, not really doing all that I would think would be done the first time I see a new doctor was because he was running behind. And the fact that he just gave me the prescription. So I thought, okay, no problem. I'll do it the next time. Well, the next time I come, he's having a problem with his machine. I'm not going to go into all of the detail. Long story short was the next time I came, he was there already. He wasn't running behind because of any protests. And my appointment lasted all of about 8 or 9 minutes. And that included my paying for the appointment. So it was just like he was an order taker. He wrote out the prescription and he gave it to me. I said I had wanted you to be my primary care doctor the last time. And you said, oh, we can take care of that next time. He's like, okay, and now I'm having a problem with my computer or whatever. So he gave me a paper, to fill out and bring back the next time. So I said, okay. And I really wasn't that pleased with the service or the quality of the service. But I thought, well, I don't have anybody better. I think that was the last time I went back to him. I think I found another doctor who was accepting new patients. And this time it was in Surrey. And so I was delighted. I was like, yay. And I went and I was having problems with my thyroid and being on the right dosage. This doctor was fresh out of medical school. And I thought, okay, this could be good. He might not be that experienced, but he probably will be thorough. And so the first time I met him, he weighed me, he took my blood pressure. He asked me lots of questions. And I was like, finally. He reduced my thyroid medication based on the results from a test that my former doctor had given me. But he really reduced it. And I thought, this is a lot. And no doctor has ever changed this dosage this much. But I thought, well, maybe this is he's got a new approach to it. I'll get the blood test in a shorter amount of time. So it should be okay. It wasn't. It was horrible. I was not feeling good after that. So I went back, got the blood tested, went back, and when he looked at the results, which were, I think, 4 or 5 times higher than the high end of the range that it should have been in, and he looked at me like, what did you do? He didn't say that, but that was his expression. And I said, oh, well, you reduced the dosage. You half the dosage of what I was taking. And he did not take responsibility for that. He didn't blame me, but there was this element that seemed to feel like that he wasn't to blame. And I didn't like that. I didn't like the fact that he made me feel sick because of what he'd done and that there was no ownership and that he didn't have a better knowledge of how to dose my medication. So I said, yeah, this isn't the doctor for me, even though I had him become my primary care physician. So suffice it to say, I am in a medical desert. Recently, the mayor has set up a new service here for people who don't have primary care physicians, and I started to go there and to try to get my thyroid medication regulated. So I've been back and forth there a couple of times, and the last time I tried to get some help there, I was turned away because on file, I have a primary care physician, the one that I won't go back to because of the treatment I received from him. So that left me this last time with having to find another doctor, another primary care doctor. So I'm going to, cut to the chase. I found one about 20 minutes from me, halfway between here and Perpignan. And I went, and I was not impressed. It was another order taker of sorts. I had to wait, but not long, not quite that long, as the first new primary care doctor I had. But I was not impressed. He did, however, give me a different treatment. He did prescribe a test, and he did give me a referral to a specialist, to an endocrinologist. So there's movement. But in terms of having him as somebody who's going to follow my health long term, I don't see that he's going to be my new primary care physician either. So I live in a medical desert. Medical deserts in France are real. Now, people who live in the town I live in might not say that it's a medical desert, but that may be because they already have a primary care doctor and they haven't gone through what I am experiencing now. If you move to France and live in a bigger metropolitan area, you probably won't have the problems that I'm experiencing. However, I have to say that I have looked for doctors in Perpignan, primary care physicians in Perpignan, and many of them are not accepting new patients. So not that Perpignan is a huge city, but it's big enough, I think, and many of the doctors there aren't accepting new patients. That could be a problem as well. I made this video just to be real, to give you a sense of what it's been like for me. Other people who move to France might not have this experience, but this is an experience, and I think there's value in hearing it, especially if you are moving to France because of the medical system, right? You need to understand where there may be some breakdowns. So choosing the place that you live wisely is really important. So that's what I wanted to share with you today, my very real experience with the French healthcare system. And even though it is wonderful on one level, in my experience and where I'm living, it can be challenging. Now, if you are planning to make a move to France and you are filled with uncertainty or concern about moving to France and you have some questions that you'd like to have answered, I offer what's called an information session. It's a 30-minute session where you can pick my brain and ask me anything about my move to France, and I will answer your questions to the best of my ability based on my experiences here. And you can schedule an information session by going to thecouragecatalyst.com/info session and booking your call there. Now, I look forward to seeing you there or seeing you once again on another video. If you enjoyed this one, please be sure to give it a thumbs up, share it with friends, subscribe, and I will see you again next time. Bye for now.